Hi, Dr. Farrell. I'm Bridget Forward, and for the purpose of this assignment, I developed an all-women's discussion group. There was no co-leader present in the group. The purpose of my group was to share health information and discuss health issues that pertain to women. My group did deviate from my proposal in two areas. First, I planned for my group to meet on Tuesday, August the 7th at 3:30. However, due to unexpected work conflicts, I ended up having the meeting on August the 8th. In addition, one member of the group was still unable to make it. Therefore, I was one person short for the requirement for this assignment. The meeting was a closed group, which I held in the resource room at our elementary school that we work at, and it lasted for an hour. I began the group with the use of a round. I asked each member to give their name, age, and a past or present health concern for them. The members were very comfortable sharing as if we've all worked together. And after letting them guess as to what was the leading cause of death in women, I provided them with a few statistics and gave a brief lecture on why it is important for women to take care of their bodies. I then had them break into dyads to discuss the health concerns that each of them mentioned at the beginning in the rounds that we had. Once we reconvened into a group setting, I allowed them to share to the group what they had talked about and discussed with each other, and how they could actually prevent the issues that they had discussed. Their health issues and concerns range from weight loss, diabetes, cancer, and heart disease. Once we finished discussing each member's health concern, we did have some time left within the hour. As you suggested, I have some additional topics that we discussed. I had stress, depression, mammograms, and menopause. I used somewhat of a group-directed intrapersonal approach to leadership. I allowed them to determine the issues we discussed at the beginning, and I directed the workflow. Everyone participated and was very engaged in the entire session. After discussing the additional topics, I asked if anyone had any additional issues that we could discuss or contribute. No one did, and I briefly summarized the topics we discussed and closed the group. In reflecting on my facilitation of the group, I think I did very well for my first group. I feel my energy was good. I started with a lot of enthusiasm in the group. It probably was nervous energy, but I don't think they could tell. I did have to use the cutting off technique at the beginning of the session when we were in rounds. It was very uncomfortable, and I almost didn't do it, but I knew I could explain at the end of the group why I did it, so I did do it. I think I did well by actively listening, and I also made a conscious effort to use my use of eyes. It was hard to do, but I made the conscious effort and I did it. I also used questioning to have certain members elaborate and clarify points that they were making and to keep them engaged. I watched for the nodding of heads, again with the use of eyes. Like I mentioned previously, I did use a round at the beginning of the group, and we did break into dyads to discuss the health concerns. I understood that I had a diverse group as well. I had the majority of Caucasian women, and I had one African American. So my statistics, I did bring both statistics for both ethnicities. I could have probably used more techniques in my group, but for my first one, I think the ones I did use was adequate and enough, considering that I was nervous. In conclusion, my experience in leading this group was very enlightening. And when I finished with the session, one of the ladies did mention that they felt like they had been in a real professional group, and so that was the most important highlight for me. My takeaway is to be prepared and just do it. I have always wanted to lead a group, of course, and but I lack the confidence in myself to do so. In addition to being prepared, knowing that things may not go exactly the way that you planned, but be able to adapt and be able to do the hard techniques like cutting off. I do need to enhance my group skills in the use of the techniques and becoming comfortable in using all of them, not just the ones that I felt that I was comfortable using. In addition, I need to gain more confidence in myself and my ability to lead a group effectively. I feel this was a great start for me, and I actually look forward to doing it again. My concluding thought would be, my group was not perfect, I guess, but now I believe in my ability to lead one. As we tell the students at school, never give up. Even your mistakes means that you're trying. And when it comes to groups and therapy, you're not only trying for yourself, you have to remember that you're trying for others as well. Thank you.